So, what is MISC? This is currently going everywhere. So, can you
So
elaborate about that?
yeah, we thought like, so what is it like, one of the red flags that we were talking about in children, like, you were asking me when should children come into the hospital. So in the, what is MI,
Common, yeah.
inflammatory systemic disorder in children actually. So what happens, the system, multi-systems are getting inflamed. So what we see is this happens in a later stage actually, what happens after 2 weeks or so. And also, we want parents after 3 days, if the diarrhea is persisting, if the child is complaining of abdominal pain, or the child is having like new rashes anywhere, or with the swollen lymph glands, like we can see swellings in the glands, or there's a rash that is peeling off on the skin. So it's very similar presentation to what we call is what we've seen in pediatric group. Kawasaki's disease, so something very, very similar to that presentation. So what we want, and most of that comes as a delayed thing because it is a reaction because of the delayed immune response actually, and this happens. So if the symptoms of like these kinds first, like present, and you're worried, like conjunctival redness, like as I said, peeling of skin, lot of vomiting and diarrhea, and patient is dehydrated and complaining of abdominal pains or headaches. So we've
Okay.
had a few children admitted in hospital, especially during the first wave. We had like around about for 50 children in Chennai who were admitted in Child Trust, and they were treated. But the good thing is they've all responded well, even like on admission and treatment. Right time, the parents have to come to the hospital without delay. The delayed presentations are the problems actually. So if they think something is going on, I know at this moment, like the fear
Okay.
for majority of parents is whether I should go to the hospital. So that is a question. But then, like you know your child well. If it is going for a long while, there is no reason to,
Yeah.
and there is no reason to do phone or online consultation because if child is sick, child is sick. Child needs to be seen. Because many of the things we can't find out, and unfortunately, we can never find out on the phone. I can always ask questions, but what you see is different from what
Oh,
you.
yeah.
So clinical examination is very, very important, especially for
Yeah.
complications. Yeah. So I've had a lot of questions of why you're not doing online. I've told very simple things I will answer that like, some things that need to be seen have to be seen. So they have to come and show. And I think getting evaluated in the hospital, in a pediatric hospital is important at that time.